So hi, I'm Shockley Wier. Everybody calls me Shock. I am a dentist that currently lives in Ohio. I started my career in dentistry back in 1991 when I went to the Ohio State University. Um, After that, I was in general practice for about 10 years, and honestly, I got a postcard in the mail from Progressive Orthodontics, and the founder, Don McGann, called me up and said, "Hey, do you like to do ortho? Or would you like to learn ortho?" And I said, "Absolutely." And he said, "Well, I'm the guy that can teach it to you." So I took POS in 2005 and became an instructor. And since then, I've been an instructor for the last 17 years. And now I'm in charge of instructor training. I write seminars for POS. In the interim, I practiced clinical ortho for 20 years and still do practice clinical ortho. I've worked in a specialty practice with an orthodontist, and I am one of the instructors that has taught every seminar in orthodontics that POS has to offer. All right, so here's the deal. I've taught ortho all over the world, and something that I've found out in every location is in dental school, generally speaking, the orthodontic education is extremely poor. They do that for a reason, because they don't want you to do ortho. That way they keep the number of providers very small. If the number of providers is small and the demand is big, you can keep the fee high. So that's the way the whole game works. And a lot of times in dental school, they give you exercises that are designed to frustrate you. And you do that exercise and you get frustrated and you say, I wanted to do ortho, but I'm no good at it, so I shouldn't do ortho. And then it keeps the pool of providers very small. POS has been around for 25, 30 years, something like that. And I've taught for them at least 15, 17 years, something like that. And I see the results that beginners provide year after year after year after year. It is actually much easier than many aspects of general dentistry. Trying to do a molar root canal correctly is extremely difficult, okay? Trying to glue a bracket on a tooth and straighten a tooth is much, much, much easier clinically, okay? Because all you're doing is sticking the bracket on the tooth. And if you don't stick the bracket on the tooth correctly, the worst thing that's gonna happen is the tooth's not gonna get straight. And when that happens, you pop the bracket off the tooth and put it on differently, and the tooth will get straight. So there really shouldn't be any fear of not being able to do good clinical ortho, especially since you have instructors behind your back the whole way. If there's any time you don't know what to do, it's just an email or a phone call away, and we can give you advice on how to proceed with the case. Again, because your first case has to be excellent. And that goes for as many cases as you want throughout your career, whether it's 1 or 100 or 1,000, whatever you need. I do say this a lot. One thing I have said is you can't be a good dentist without knowing orthodontics. And first off, you have to understand occlusion. And a lot of general dentists don't really understand how the teeth are supposed to fit together, okay? Orthodontics gives you the ability to understand how the teeth fit together. So once you know how the teeth fit together, it gives you the ability to do better restorative. If you have an edentulous space with teeth adjacent to it that are tipped into the space, it's impossible to do excellent restorative dentistry because the teeth are so malpositioned. So trying to upright teeth and create pre-restorative setups is huge in the field of ortho. We had a girl yesterday who, in the intro, who just got out of dental school. Mm-hmm. And her mom took POS a while ago and thought her daughter needed to learn that. Now I'm biased because I like to do ortho. I wish I would have learned to do ortho right out of dental school. You're fresh, you're still in that learning mode, and it is a very good part of dentistry to know very early on. You have to understand, ortho is a want-based dentistry instead of need-based dentistry. People want ortho, people don't want dentistry. So since they want that, you want to provide what people want. So I think it's great to learn that as early as possible in your career. But I'm going to say at the same time, I get a lot of doctors that are at the end of their career. Okay? Now, you have to understand, dentistry is hard on your body. It really is. And what if you start to get some kind of tremor or something like that? How are you going to do dentistry if your hands are shaking? Okay? Well, ortho, if you know ortho, as long as you can think, you can do ortho. Okay? So there's a lot of people that like to learn ortho. It's not physically demanding. You do have to think. Okay? But it's easy and it's profitable, so it's a good thing for people at the end of their career as well. Nearly every orthodontic case starts the same. You have to align the teeth. We have something called a nickel titanium wire, and a nickel titanium wire straightens the teeth. It's going to take 3 or 4 months for that wire to work. You're going to have to get into a stiffer nickel titanium wire for another 6 months before you do anything. So in the first 9 months of a case, all you're going to do is glue brackets on teeth and put 2 different wires in there and let the teeth get straight. You will have that 9 months to gain a lot of education while the teeth are getting straight. And then once the teeth are straight, you'll know a lot so that you will be able to proceed with the case at the appropriate time. Yeah, I'll tell you, the biggest challenges that I had, and the thing that I've seen, not just from when I was learning, but from teaching students over the years, the biggest areas that I struggle are mechanics, trying to learn how to move the teeth in different directions. None of the clinical aspect of it is difficult. Everything that you do in orthodontics is extremely easy. As long as you can glue a bracket onto a tooth and make it stick, it's really easy to do things like packing coils and using springs and things like that. But when you're beginning, you don't know how to use all the different tools. That's the problem. Even though each tool is very easy to use, there's a lot of different tools in the toolbox. So it's nice to be able to reach out to someone to get some advice to see what might be the best tool in the toolbox to treat the case. Well, I've got a good story as far as that goes. Honestly, I had just started doing ortho. I mean, and this is one of my very, very, very first cases. And I started a lot of cases early. Again, Don got a hold of me and said, start as many cases as you can. And I believed it and I did it. And one case I had sent to an orthodontist to to an oral surgeon to have a couple teeth removed. And the oral surgeon basically, since I wasn't an orthodontist, questioned what I was doing. And I took offense to that. And but I didn't say anything, it is what it is, and he's entitled to his opinion. I'm entitled to mine. But the interesting story is, about 2 months after that, I had just taken the braces off of, because that was a start case. I had, about 2 months after that, I had taken the braces off of someone, and they decided to go get their wisdom teeth removed. So I gave them a referral to the same specialist to have the wisdom teeth removed, and they went out there, and the specialist the oral surgeon looked at the case and said it was one of the most beautiful orthodontic cases that he had ever seen, that the occlusion was perfect, and he wanted to know who was doing such quality orthodontic work. Well, it ends up it was the same guy where he had tried to question my work before. So it's interesting that when he doesn't know who did the work, he questioned it, or he thought it was excellent, but whenever he thought it was a GP doing it, he wanted to question it a little bit. Okay, so it speaks a lot to the power of the ability of a GP to do specialty level work. Okay, so when someone sends me a case, the first thing that is exceedingly important is that you have quality records. Okay, in orthodontics, in the specialty, records are everything, and orthodontists take a lot of pride in having records. You know, to give an example how important it is, when I was working in an orthodontist office, we had one person, all they did all day long was crop photographs to make sure the photographs were appropriate in the collage, which is where you put all the patient records. So we really strive to start with good records. Okay. After that's occurred, again, the students struggle with the mechanics. So I'm looking for, students send me a lot of progress pictures and things like that. And I'm looking to see whether they're doing mechanics or correctly or incorrectly, but also I'm looking for ways to increase the efficiency of their mechanics so that they can get through the case with less unwanted tooth movements and finish with a better result in a shorter period of time. I need to make sure that you're successful, especially in your very first cases. Okay, because if you're not if you do a case and your first case is a struggle and you have a hard time, you're going to be less likely to continue to do orthodontics. So I need you to do a quality job without too much difficulty, just to build your confidence that you can actually do this. Therefore, in the beginning, I need to pick cases which I can ensure that you're going to be successful with without too much difficulty. Therefore, the mechanics in there might be a little easier. Now, I do have a lot of students that come in with previous training and things like that. Now, if you do have previous training, I can teach you from the alphabet to the PhD. It just depends where you are on the scale, and POS tries to make sure that they have resources catered to each ability. As I became an instructor, you know, whenever Don and I talked about me learning ortho, he told me he was going to give me a gift to learn how to do ortho, and he asked me that I give it back to someone else. So I decided I learned how to do ortho at a very high level, so I wanted to give that back to others. So I try to train other dentists at a very high level in orthodontics. I want to be the consultant that others were to me when I was learning, because that was a big reason that I was successful.